Sciatica diagnosis. Sciatica diagnosis and treatment is essential after a thorough physical examination. However, it is crucial to note that sciatica by itself is simply a symptom and not a complete diagnosis. That means that sciatica describes a pain or numbness or a tingling sensation down your leg. However, this does nothing to explain the cause of these symptoms. Sciatic nerve pain can come from multiple different sources. The most effective exercises and treatment for sciatica can vary greatly depending on where your nerve pain is originating. The information presented in this video is for informational purposes only. This information is, in no way, meant to be used as personal or individual treatment recommendations. I would always encourage you to go get assessed by a local doctor or physical therapist for the best treatment plan for your specific needs. Diagnosis: sciatica. Pain relief. Doctors gave up fixing her sciatica, but today she feels brand new. After helping hundreds of people who suffer from painful sciatica and battling it myself when I was younger, I can tell there's probably a no more aggravating form of back pain. Sometimes you can't sit. Sometimes you can't stand. Sometimes you can't walk or drive, or even lie in bed. The pain is merely wretched. A couple of days ago, I've met a lady on her hands and knees. It was the only way she could find relief. She was in tears. The pain radiating down her legs was unbearable. The first thing you should appreciate is sciatica is not a disease. That's right. Allow me to be clear about this because it's important. Sciatica is not a diagnosis. Let me mention here that these opinions belong to Ian Hart, running a website called My Back Pain Coach. If you're seeing a doctor and telling you that's what you have, you're not being told the whole truth. Let's put it this way. Sciatica is a symptom. The doctor is only labeling a symptom. They're not telling you what is actually wrong. Now when they put a label your pain, I totally get how good that makes you feel at the moment. What happens next? They prescribe some heavy-duty ibuprofen to calm the inflammation, maybe ship you off to a physical therapist. Then they're on to the next patient. And you already know how that works, don't we? Let's face it. The reality is a lot of doctors fail to fix their sciatica patients. They repeatedly return with the same pain, the same issue, the same cry for help. The doctor eventually begins to wonder whether the patient even wants to get better. Imagine that. It doesn't entirely occur to them, it could be the treatment that's not working. And that's because their sciatica diagnosis just becomes an easy way of sending the patient home happy. Sciatica is the term that describes symptoms of pain that begins in the lower back and extends down through your butt, thigh, and sometimes as far as your foot. Most likely, that tingling or painful sensation going down your leg is caused upstream in your spine, such as irritating, compressing or pinching degenerative disc disease causing the vertebra to hit a nerve. A facet joint at the back of a vertebra that is out of alignment. A strained back muscle is spasming and painfully squeezing a nearby nerve or nerve sheaths. Well then, multiply these issues by the number of vertebrae and muscles in the back. You can start to appreciate how much work there is to accurately diagnose the problem, even with new technology such as MRIs. Which is why most doctors feel they're doing the best they can given the resources available. Let's go on with sciatica and the back pain. That's why I prefer to take a more self-directed, holistic approach to addressing sciatica. Let me remind you again that these are Ian Hart's words. So, how do we fix the pain and numbness? Recently, a young mother came into my clinic. Even after years of chiropractic treatment, for some reason, she still suffered from sciatica. Actually, I was rather shocked to think if a young mom can be dealt with a crippling back pain blow, what does this say about the rest of us? Here's Patty's inspiring story in her own words. I think it'll inspire hope if you're also suffering. My sciatica was my big issue. I had constant back pain since my child was born. He's 14 now. My hip, shoulder, and neck hurt as well. I saw a chiropractor for about 4 years twice a month and I still had issues flaring up. When it did flare up, I was down and up for about 3 months at a time. He couldn't fix it. My life was just working and coming home, trying to manage the pain. My family was pretty much without me during that time. I wasn't able to exercise and gained a lot of weight. I felt scared to do anything besides work, to make it worse. I was skeptical about using Ian's program just because I didn't want to injure myself anymore. I felt like doing nothing or only seeing the chiropractor was a way to get any relief. Since I discovered Ian, it's been great. I've had no muscle pain at all. I haven't had to see my chiropractor once. I exercise, and I'm able to be active at work. I have no neck or shoulder pain whatsoever. When it was awful, I couldn't even grocery shop. Just standing on a concrete floor in the grocery store hurt so bad. I could just get 1 or 2 items at a time. When I do Ian's program, it feels like my back, neck, and shoulder get that same adjustment that I used to get from the chiropractor. So it's been fantastic. It's great. How did we help Patty? She did 8 specific movements. These 8 movements are totally unlike the sheets of exercises you get from chiropractors or doctors. Instead, we wake up specific muscles and restore muscle balance. That's key. Then in some regions of her back, we jump-started pathways so vital oxygen and nutrition could get in and help her heal. That's the holistic way to relieve sciatica. It's not uncommon, but in Patty's case, it took just a couple of sessions. A couple of sessions and she was ultimately out of pain. Yes, there are ways to get out of pain. They don't require medication, surgery, or injections. They don't require months of physiotherapy. You just have to restore your body's natural functional movement and muscle balance and allow it to heal naturally. If you liked this video, please, give it a thumbs up and subscribe to my channel. All medical considerations should be taken with care. I am promoting an affiliate program, meaning that, if you buy, I'll get a small commission at no extra cost for you. Please, see the vendor's specifications and visit your doctor.